Amery Hocutt, and I'm going to tell you about the most common winter sickness, influenza, or more commonly known as the flu. It is a respiratory illness that is caused by a virus. Flu is highly contagious, and it can be spread from person to person by coughs or sneezes. You can catch the flu from an infected person just by touching them. Adults are contagious one day before getting the flu, so you can actually spread the flu before you know you even have it. And they're contagious for up to 7 days after becoming ill. Between 5 and 20% of all Americans get the flu every year, and more than 200,000 people are hospitalized from the flu. 36,000 people die annually from getting the flu. Some of the symptoms from having the flu, they can be mistaken with common cold symptoms like runny nose or sore throat. Some symptoms which a person with the flu will have that are not normal common cold symptoms are a high fever, cold sweats and shivers, a headache, aching joints and limbs, and fatigue, feeling very exhausted. Some more are being nauseated or having vomiting. These symptoms may linger for about a week, and you can stay tired and feel gloomy for up to several weeks after you're over your flu virus. How serious is flu? In the majority of the cases, flu is not very serious. Your risk of experiencing severe complications are greater if you're over 65 years old. If you're a baby or very young child, you have a greater risk of getting the flu, and it's worse for you. If you're pregnant, if you have some kind of heart or cardiovascular disease, if you have a chest problem like asthma or bronchitis, if you have a kidney disease, if you suffer from diabetes and suffering or from taking steroids, or you're undergoing treatment for cancer, it can be more serious for you. If you have the flu, you should stay at home. Try to avoid contact with other people, and try to keep warm and rest. Make sure you consume plenty of liquids and do not consume alcohol. If you're a smoker, you should stop smoking and cut your consumptions down as much as you can. Try to get some food down. Eat what you can and try to keep it down. If you live alone, tell a relative or a friend or a neighbor that you have the flu, just so somebody come in and check on you. You should only contact your doctor if you feel frail or you're elderly, your temperature remains high for 4 or 5 days, your symptoms worsen, you think you're seriously ill, or you become short of breath. A phone call to your doctor wouldn't hurt when you first get the flu. To prevent the flu, health experts and agencies throughout the world say that the single best way to protect yourself from getting the flu each year is to get a vaccination. There are 2 types of vaccinations, the flu shot, and they have a nasal spray flu vaccination. The flu vaccination is not suitable for some people. You should check with your doctor before deciding to have the flu shot. If you have a severe allergy to chicken eggs, you have a severe reaction to a flu vaccination once before, if you've developed Guillain-Barré syndrome 6 weeks before receiving a flu shot, if you're less than 6 months old, you should not get a flu shot. There are 3 types of flu viruses: influenza A, influenza B, and influenza C. Types A and B are the most seasonal, most common types of flu. They hit the U.S. and Europe every winter. The C influenza viruses can be mild respiratory illness and not responsible for epidemics.